Right. The coronavirus outbreak has seen countries across the continent make crisis budget allocations to fund efforts to contain this pandemic. Still, millions of Africans are unable to access or afford the services they need to survive and thrive without incurring financial hardship.
And we will be looking at the example of Rwanda, which has been termed as the beacon of universal health coverage in Africa by the World Health Organization. We will also be speaking to Elsie Kanza, the head of Africa at the World Economic Forum, ready to answer some of your questions, so keep them coming. I'm Zawadi Mdibo.
And my name is Maya Hayakawa.
But first, what has the situation been like for those in government quarantine facilities over the coronavirus? Let's hear from Dr. Paul Mungai, who has been in a government-allocated quarantine facility in Nairobi, Kenya for the last 2 weeks after traveling from Johannesburg, South Africa.
My views are based on a personal experience during an ongoing mandatory quarantine at Fungamano House on Status Road, Nairobi, where I've been for 15 days. All 6 of us at this site have been waiting for the Ministry of Health to type our discharge letters, get the director in charge from one of the boardrooms to sign, then order a messenger to deliver them to us. This is not only bureaucratic, but also against COVID-19 safety measures. So from a scale of 1 to 10, I'll be generous to score our beloved government at 4 out of 10 based on 5 points. Number 1, quality assurance guidelines, where we ask ourselves, do school dormitories qualify as quarantine sites? Think of shared bathrooms, shared cubicles, and the messy and unhygienic catering at Nairobi School and KMTC. Also, the Ministry of Health is still being crippled by too much unnecessary red tape for bureaucracy. For instance, if someone tests negative and has served 14 days in a site without COVID, why keep them hostage? I urge our beloved government to have less talk and have more action on this matter.
Well, quite an experience. We are now joined by Elsie Kanza, the head of Africa at the World Economic Forum, and she's coming to us from Geneva, Switzerland. Elsie, if you heard what Dr. Mungai mentioned, what are your thoughts?
I agree with him that clearly there are critical actions that need to happen that can have a bigger impact in terms of how people are having to respond to the crisis individually. At the same time, if you allow me to zoom out a little bit and start off on the global level, yes, we also need to be aware of the ecosystem that our governments are operating in. According to the African Union Africa Center for Disease Control, as of the 3rd of April or so, we only had about 7,000 cases in Africa in terms of infections, and the death rates are just under 300. So clearly we're just at the beginning of the crisis, just by what we're experiencing here in Europe. Look at Italy, even here in Switzerland, France, Spain, very much in the epicenter. And therefore the impact on Africa is expected to be devastating, to put it lightly. Think about the effects in 2 ways. There's those that are external to the continent. This relates to trade. About 1/3 of African countries depend on the their exports to the rest of the world, exports of raw materials for their revenues. Think about it in terms of tourism. The rest of the world sees it as travel for enjoyment. In the African context, it's really much more about revenues as well as employment. So you have countries like Kenya, South Africa, Nigeria, Tanzania, and Ethiopia, where more than 1 million people are employed in the tourism sector, which has now been disrupted because airlines are not flying, people cannot move from place to place, there are travel bans in place. We're also seeing declines in remittances, in foreign direct investment. The list could go on, but those are external. And then internally within the continent, we're already starting to see negative effects in terms of healthcare as countries scramble to get facilities up to scratch, so to speak. They were weak beforehand, and now governments are having to operate under a crisis mode to close those gaps, whether it's protective equipment, it's a tracing efforts, testing kits, ICU units, as well as ventilators. We're seeing the impact of disruption also on economic livelihoods. One, because of the slowdown of business overall, supply chains have been disrupted. But two, also now with lockdowns where you have business people not able to operate. And in many countries, over 80% of businesses are in the informal sector. That's a huge loss for individuals in terms of livelihood. But then for the formal sector, it's also a huge loss for government in terms of tax revenue that they're expecting from the business sector. Food supplies are also being disrupted, and Africa is a net importer. So as you can see, there's a broad list in terms of the categories of demands in terms of the tensions. With respect to responses, that means we're also seeing efforts on 3 levels, if I can put it that way. One is an appeal to the rest of the world. This was made by Prime Minister Abiy Ahmed of Ethiopia regarding the estimated overall cost of 100 billion. So far, it's estimated that the negative impact collectively could amount to that. We'll get a better picture as we go along. This was an appeal that was shared to the G20 because we are neighbors. On a regional level, the African Development Bank issued a bond that was oversubscribed, a 3 billion bond. The fight COVID, it's to deal with social and economic impacts of countries in Africa.
Thank you, Elsie. Allow me to cut you short because I know you're getting into the numbers and we'll be coming to that shortly. But I know, Maya, you have some of these numbers. What do they look like?
That's right, Zawadi. I'll take you through the different numbers across the continent. But I also would like to remind that all of you guys that are viewing, wherever you are right now, make sure that you send in your questions. Elsie is on standby to answer all of your questions. Send in your comments, send in your questions, and Zawadi and I will definitely get to you guys. But for now, let's look at the actual status of Africa's health financing and what it looks like. Now, the IMF is making $50 billion available from its emergency financing facilities, and some 80 countries have already asked for help, including about 20 countries from Africa. The World Bank Group has also approved a $12 billion COVID-19 response package. What are African governments doing in response? Let's start off with Rwanda, which is the beacon of universal health coverage in Africa. Now, according to the World Health Organization, it is the first African country to secure $100 million. Hold on there. I'm just trying to get the numbers to pop up. But $1 million in emergency coronavirus funding from the IMF. Now, Rwanda's cabinet members and other senior government officials resolved to forfeit their Africa salaries in show of solidarity. Let's take a look at other African countries. Seem to be having some technical issues there. Let's look now at Nigeria. Nigeria's government has announced plans to set up for a $1.4 billion coronavirus fund to strengthen its healthcare infrastructure. So how will they spend this money? Over $2 million will go to the COVID-19 basket fund to support socio-economic measures such as cash transfers or food distribution to vulnerable groups. So we've been listening to other people across the continent. So how can Nigeria help build capacity in its healthcare system during the pandemic? Nigeria's Irene Ubani has a suggestion. Listen to this.
We've seen a lot of banks, CBA, GT Bank, and a host of others coming together to either contribute to what the government already has or building isolation centers, which has proved very, very effective. So I want to see the government, build up more of these partnerships to ensure that they're making available everything that the medical practitioners would have.
Well, we have some comments already coming in fast and furious. I see people tuned in. We have Merlinda Mbiru from Zimbabwe. We have Diana from New York. And Yona Soko, watching from Zambia, is asking, it's now 5 days with no new COVID cases.
Right.
And she's asking, what is the way forward?
Zawadi, look at this. We have a few comments that are coming in from Facebook. Let's look at what some of these guys have to say.
Raymond, do you think COVID-19 pandemic will affect donor funding for Africa? Foreign countries, especially the US, has been supporting most African countries to improve their healthcare system. So those are some of the questions that I know Elsie is on standby to speak to us about. Therefore, Elsie, you had the question from Raymond. Do you think COVID-19 pandemic will affect donor funding for Africa?
Definitely in the short run. Our houses are burning here as we speak, and there's a scrambling to mobilize resources to stabilize the European Union, for example, because they still have high rates of deaths.
About the issue about the poor health systems
Look at this.
in Africa.
There's another question here from Malay.
Malay says, what will you recommend for African aviation entities to do in terms of early collaboration and strategies in serving employment models?
That's a great question. Elsie?
What we're seeing with the aviation sector, similar to other industries that have been heavily disrupted, is that they need to be repurposed to support the efforts to fight the pandemic. So if we use the example of Ethiopian Airlines, that is currently being used to ship supplies from China to Africa, and one key example is the donation by Jack Ma, and then using the Addis Ababa hub as a way to reach different countries, because the donation was to many countries across the continent. So that is one way in which the aviation industry can try to keep going. In the short run, unfortunately, as long as travel bans continue around the world, it is not possible for the airlines to continue their business. And so different associations are seeing how they can get support from their governments to be able to keep the staff at home, but still employed.
Elsie, we still have a few more questions here. We're trying to get in as many comments as possible. Zawadi?
Alfred Mamadou says, I have witnessed hard-hit countries use their national stockpile as mitigating strategy for a way of swiftly responding to the crisis. Considering the contagion of viruses, does governments on the continent of Africa have national stockpile for medical equipment?
Well, this looks more like a comment than it is a question.
Yeah, so let's go to that. Yes, so Zwelipe Zilengela says, will national health insurances by governments be ever able to cope with the pandemics like these in the future if the spread is so viral?
Good question. Elsie, what do you think?
Yeah. What I think is that more collaboration is happening and needs to happen. And what we're seeing is the insurance industry globally, and this also includes national insurance companies or private insurance companies in Africa, think about how they can respond to the crisis. And so we will see solutions coming on board soon.
Fantastic. Thank you, Elsie, so much. Elsie is still on standby to answer all of your questions, so make sure that you keep sending out your Facebook comments. Zawadi is on standby as well, looking at your comments and getting ready with the questions to ask Elsie. But then for now, let's take a look at those numbers and move over to South Africa and take a look at what those numbers look like. South Africa is still on lockdown. However, the government has set aside $65 million for small-scale farmers to mitigate food scarcity. Women, youth, and the disabled will also be prioritized. Let's take a look at what Kenya is doing. Kenya's President Kenyatta has directed the National Treasury to channel about $20 million of money recovered from corruption scandals and proceeds towards supporting the needy and the vulnerable. The World Bank Group has also approved $50 million in immediate funding to support the COVID-19 fight. Now, access to a health facility in Africa can be a huge challenge, especially in rural parts of Africa. And Tutaleni from Namibia has a really interesting idea on how we can get around that. Take a look at this.
Another thing that the government can do is that the doctors that we have who are at home and have no jobs, they should be called in so that they can assist as soon as possible.
Zawadi, what do you think about that? That's a really interesting comment there from Tutaleni, saying we should, convert all of our pubs and our restaurants into isolation centers. Do you think that's something that can work in Africa?
Well, that might work, but then look at the hygiene standards of such places. Will that really work? Maybe not. And I think this is just about the right time to bring back Elsie, because we want to understand how African governments can mitigate the impact of COVID-19 on the economy. And I think, Elsie, you have some thoughts on that.
Right. So one clear thing that we're seeing is a call for solidarity. Let's face it, as far as the economic impact is concerned, we need to get ahead of the virus. because as long as it continues to spread, activities cannot continue as normal. And in that regard, what we see happening is countries rallying together to establish hubs of excellence in Eastern Africa, Southern Africa, Western Africa, Central and North Africa, because neighbors can do more together. What we also need to see, and is happening, but slowly, we hope it can be speeded up, is collaboration between the private sector and the public sector. So, for example, repurposing garment factories to be able to produce protective equipment, repurposing automotive factories and manufacturers working to produce ventilators. These efforts cannot be done just by a single sector. The private sector has to meet the health standards, approvals, and they also need to be able to meet the demands and be able to get those supplies to the countries. So we need to open up humanitarian corridors so these hubs of excellence can supply neighboring countries.
Elsie, I have another interesting comment here that's coming in from Facebook. It says here, in Tanzania, we are experiencing the economic hit more than the actual virus. Zawadi, this is a concern that a lot of African countries have had. So this person is asking, what is your advice for business owners who are currently unsure if it's safe to reopen and try to resume business?
Yes. It's a very good point. Apart from the economic livelihoods, we're also concerned about food. And so what we are doing as the World Economic Forum in collaboration with our partners, for instance, on the food part, working with Outer NEPAD to see how we can get food to people so they don't feel compelled to have to go out and earn a living to buy food. With respect to economic activity, this is also an opportunity, this crisis. So how can e-commerce be enabled so that people can buy food and it supports the delivery industry, for example?
Well, Elsie, also, you mentioned the issue about how governments can come together to mitigate this problem. But I was just wondering, how can they work together to produce a vaccine? We've had conversations about a test for vaccines in Africa. What are your thoughts?
Well, the vaccine problem is an interesting one. First of all, to develop a vaccine on an accelerated basis takes 12 to 18 months. And we've seen an incredible collaboration amongst major vaccine producers in the world, as well as mobilization of funding. More than $2 billion of funding is needed to support vaccine trials. The key concern about why it takes so long is that whatever they come up with, and very soon we will have, the testing is actually starting as we speak, is the concern that vaccines can also harm people. So we have to go through the trial period. And yes, it's very controversial to suggest that Africa should be a guinea pig. At the same time, trials should take place around the world in case the virus mutates.
Well, thank you very much, Elsie. Just hold your thought. We'll come back to you shortly. But I want us to move on now to Ghana. Ghana has made significant strides towards universal health coverage as part of its response to coronavirus pandemic. And government there has exempted health workers from paying taxes for 3 months and introduced an additional allowance of 50% of their basic salary for a period of 4 months.
This provides an opportunity for us to adopt an inward-looking approach by being self-dependent rather than heavily depending on the developed world. Ultimately, as our president said, we can resurrect a dead economy. What we can't do is to resurrect dead people.
Right, that was just a perspective there from Ghana. Continue sending in your Facebook comments, whatever questions that you may have, and we will definitely make sure that those questions are answered. Let's take a look at some of the comments that are coming in. This is a live feed coming in right now. Let's see what Mark Marville has to say. He says, in case this pandemic continues for longer, do you think African countries can support its citizens with the basic needs of life? Shelters, food, water, and electricity, a huge concern for many African countries, considering the fact that we have a large population that are living under $1 a day. A very valid question there, Zawadi. Definitely will throw out these questions. I know that you have an expert on standby.
Correct.
Take note of these questions. This one is from Dapo, who says, what roles should the African Union play in coordinating an effective regional response? What role should the African Union play in coordinating an effective regional response. And another comment here, what are your plans for a country who have no facilities to combat COVID-19 like South Sudan, who have confirmed 2 cases? Is it only preventative measures without life-supporting medical attention? Quite a valid question there. Zawadi, I'll throw it over to you. I know you have an expert on standby to answer those questions.
Correct. And maybe you could be wondering, what is the role of the private sector in enhancing access to healthcare financing? And we are just joined right now by Dr. Amit Theka, the chairman of the Africa Healthcare Federation, and he'll be talking to us a little bit about this. But Theka, good to have you on the program. Why has it been very difficult for universal healthcare to be available for most of Africa?
Thank you, Zawadi. For the past 10 years, we've been trying to put the UHC in place, and it's really been access to finance. But besides that, it's also been the leadership around structuring the health system to respond to primary healthcare. And now with the COVID coming into Africa, all those formulas and preparations are now kept aside, and we have to start building critical care and testing capacity in the health system. So really, one of the problems has been finance in getting enough money for healthcare. Not only were we lacking enough money for healthcare, but we were also not getting the best healthcare for the money that was available in Africa. And that's really been the bottom line challenge.
The universal healthcare seeks to provide financial risk protection for the populace, but then how can private sector insurance providers plug in?
It's a good question. It's difficult. Remember, the private insurance receives premium and then covers its members, and it provides that kind of protection to the paying population. Now, the bulk of the population in Africa are in the informal sector and the unemployment. And this is squarely the responsibility of the government, using those funds to provide an overlay of protection. So as private sector, we've been trying to use techniques, public-private partnership, in pushing all the governments in Africa to move towards UHC by looking after the vulnerable population first. You talked about Rwanda as the beacon of hope. A lot of the funding is coming right from the government. Look at Ghana, it's repurposing the tax money that it collects. Kenya, on the other hand, is using employment tax and using money from the treasury, known as the UHC fund, to provide a wider coverage. So the journey was just beginning in Africa for UHC, and we found COVID literally there when we are not prepared.
Correct. I think, Maya, you have some questions right there also.
Yeah, I find it really interesting, Dr. Amit, when you talk about us being caught off guard. There's a question here from Benson, and he's asking, why is Africa still behind in the world? We have the best doctors, the best scientists and engineers, name it abroad. And this is a challenge that, the globe is facing, looking at the numbers of the doctors that are available, and we've seen the US actually open their borders, calling for people to apply for jobs. There've been huge concerns that this would have a brain drain effect in Africa, our doctors moving out to the US. So why are we still behind?
I think, it's pretty obvious. It's resources. We've had challenges of resources, and we've had challenges of finding the right health system strengthening models, of finding the right skills. We have 24% of the world's population and only 3% of the global health workforce. So we're in a challenging situation, and we have a large population, and a lot of our population have two major issues. One was geographical and the other was financial. These two main aspects have made it very difficult for us to move ahead, and that's why we are lagging behind in this fight to UHC and having a robust health system.
Thank you, Dr. Amit, for that. We still have Elsie on standby as well. This person is from Gambia. He says, I live in the Gambia. The situation is a bit stable here, as the cases are not on the increase every day. But the worry on many people's mind is the recent extension of state of public emergency by the government, which has left some businesses to shut down knowing fully well majority of our population live from hand to mouth. So this is a huge concern, Elsie.
Yes.
Are some of these governments making these calls too early, or are these measures really necessary despite the low numbers in some of these African countries? What do you think?
We're all very worried, so I share that worry. The world is learning as we go along, and countries that have shut down their operations quickly have managed to slow the spread of the virus, which is why you're seeing these draconian measures being taken, even if the infection rate is still low, so that it does not get out of hand. What we're equally seeing, particularly over the last week, is an appreciation that when most of your people are in the informal economy and living from hand to mouth, we need to find alternative measures other than them not being able to go out. You have the example of Rwanda that has opted to take food to people and support them in their homes. We have an opening up, if you look at India as an example, population of 1 billion, where they're trying to create ways to open up markets and so that people can still access informal open air markets.
Right.
But there's a scrambling for ideas. That's what I can say, because it's a shared concern.
Absolutely. Thank you, Elsie, for that. We have a few minutes. We have 2 minutes here. This question is directed to you, Doctor, from Brian. He's asking, what can be the measure unique for African countries to prevent the spread of COVID-19 in the local communities where medical facilities are lacking?
Yeah, it's a very good question. Where medical facilities are lacking, I think we really need to embrace technology quickly. I think digital health and a continental strategy is important. We need to literally prevent people getting sick from COVID. At the moment, we have 10,000 odd cases. Only about 10% have recovered, and 90% of the cases we have in Africa are active. You literally look at the curve of the number of cases going up every day. We are mirroring the exact curve of Europe. So we've got a window of 2 weeks before we are actually hit hard. So the shield that we need to protect all our medical facilities and all our service providers and health workers is literally, we should be using $8 out of every new $10 in supporting these medical facilities, these health workers, because if we don't protect the health system and make them strong, all the other economic indicators and economic interventions will be wiped out. So the recovery from COVID for Africa will take much longer if we don't invest in the health system. And that's the question that has been posed here. The time is now. Every new dollar must have at least 80% spent in strengthening a health system before we reach 100,000 cases on our continent. We should stop any kind of models that will spread the coronavirus. We should practice social distancing. We should practice personal hygiene, and we should be following strict protocols of infection prevention control in the countries, because it's not the virus that moves by itself, it's the people that move with the virus. It's a tough call, it's a tough decision, and I know that in many parts of Africa this is going to be a huge political decision, and you can see the gradual lockdown of cities, regions, and sometimes countries that are taking place. But my appeal is really for us to come together with a continental strategy and work towards building and protecting the health system right now, and building and protecting the health workers, increasing the level of services, and embracing digital technology to bridge the geographical barrier.
Right. Dr. Amit Taka, Chairman of the Africa Healthcare Federation, thank you so much for joining us. Such a wonderful point that he made there. For me, the key takeaway is that we all need to be responsible for ensuring that we curb the spread of the virus. Make sure that you're taking responsibility to ensure that you're doing that.
Correct. And he made a recommendation, $8 in every 10 to invest in the healthcare system. We appreciate you for joining us on our Facebook Live today. We had Elsie Kanza, the Africa head for the World Economic Forum, coming to us from Geneva, Switzerland. And I'm Zawadi Mdibo.
And my name is Maya Hayakawa. That's it for our Facebook Live today. Thank you so much for watching. Thank you for sending in your comments and your questions. And I guess we'll see you next time. Thanks for watching. Goodbye.
Bye-bye.